Our guest today is no stranger to this show. Last time he explained the complexity of the HIV virus and its impact on the immune system. Since then, he has become a viral sensation after presenting the promising HIV cure trial at the Conference for Retroviruses and Opportunistic Infections in San Francisco, USA in March. The study shows how the immune system could potentially control HIV without the need for long-term medication. This could transform the fight against HIV, particularly on the continent and globally. He's long considered antiretroviral therapy one of science's greatest miracles, and now with the HIV cure trial, he might just be part of the lineage of miracle workers. Today, we're diving deep into the science behind this revolutionary trial and what it could mean for millions. Professor Thumbi Ndung'u is an infectious disease researcher focused on HIV, AIDS, and TB. His work focuses on how the body's immune system fights or adapts to viruses, particularly HIV. He was the first scientist to clone the HIV subtype C, which is prevalent in Africa, and has won many awards for his exceptional work, the most recent being the Katie Jean Retrovirology Award in 2023. Thumbi is, among many things, the Director of Basic and Translational Sciences at Africa Health Research Institute, ARI, in KwaZulu-Natal, a professor in HIV TB research at the University of KwaZulu-Natal as well, and Program Director at the Sub-Saharan African Network for TB HIV Research Excellence, SANTE. This list barely touches the surface. We're very excited to have you back, Thumbi. Karibu tena.
Asante, and it's good to be back, Juliet.
No, karibu. And, it's exciting to have you back at such a pivotal moment, and a hallmark moment in medicine. Congratulations on leading the first groundbreaking HIV cure trial in Africa. You are already a rock star in your field. But how are you adjusting to these new levels of fame, Thumbi?
I'm taking it in my stride. I try not to get too overly excited, but at the same time, I'm very proud of the achievement and especially of being part of this team. It's always about teamwork and it's always about partnership, and so I'm very proud to have been part of this team. And for somebody like myself who grew up in rural Kenya, I'm hoping that this can be an inspiration to the young people out there who are thinking about making a career in science or in other fields, and who believe in the African, in a positive vision of Africa, that we can make our continent much better. So, very, very happy about this moment, and very, very delighted to be part of this effort.
Thumbi, can you tell us about this groundbreaking HIV cure trial, this first of its kind clinical trials on the continent, and the key discoveries that you've made so far?
Oh, thank you very much, Juliet. So this was a small study. It involved 20 people, all of them women. And what we did in this study was to give them antiretroviral therapy for at least 1 year. That is normally the way you would control HIV, is through antiretroviral therapy. So we gave them antiretroviral therapy for 1 year, and then we gave them an intervention, which is an immunotherapy. In this case, broadly neutralizing antibodies and another product that we call a toll-like receptor agonist. And then we stopped the treatment, the antiretroviral treatment. And the idea is to see whether, if you give this intervention, somebody can control the virus without antiretroviral therapy. And what we observed is that in 4 out of 20 of the participants in our study, they were able to control the virus without antiretroviral therapy for 1 year. So they went for 1 year without the need of taking daily antiretroviral therapy. So that's an important milestone, because it shows that it is possible, at least in some cases, for people to control the virus without antiretroviral therapy.
Last time you were here, and just going into a deeper understanding of what's happening at the cellular level. Last time you were here, you said something about how the HIV virus, very different to the COVID virus, enters the cell. So, what is exactly happening to these people who are able to combat the virus on their own? And should we expect the same to be happening to a possibility of that happening to other people as well?
So that's a really good question and an important question. So what the thing about HIV is that antiretroviral therapies are very good at controlling the virus, and they control the virus to undetectable levels. In other words, you cannot see any virus that is circulating freely in the blood when somebody is taking antiretroviral therapy. The problem with antiretroviral therapy is that although it's very, very good in controlling the virus, it does not eradicate the virus from the body. And so the person has to take antiretroviral therapy every single day
For lifetime.
for the rest of their life, because the antiretroviral therapy does not eliminate HIV. What our study is showing is that it is at least possible in some cases, and for at least 1 year, to control the virus without the need for antiretroviral therapy. So it's not a complete cure, but it is a step towards achieving what most people living with HIV would like to achieve, which is not have to take antiretroviral therapy every single day for life.
Because Thumbi, remind us again, for people living with HIV, they are still taking ARVs on a daily, correct? Or multiple times a day?
That's correct. That's correct. The guidelines that are widely accepted and that we all recommend as scientists for people living with HIV is that they should take antiretroviral therapy, because if they take antiretroviral therapy, it benefits their health, their immune system, so they will not develop what we call opportunistic infections. But also very importantly is that it makes the viral load undetectable, which means that that virus cannot be transmitted to somebody else, for example, during a sexual encounter. So that's very, very important. It keeps the person healthy, and it makes the virus untransmissible to somebody else. But the antiretroviral therapy has to be taken for life and every single day. At the moment, you have to take a pill every single day. So what we are trying to do in our research for HIV cure is to find an alternative to antiretroviral therapy. And there are two ways of doing that. One could be complete eradication of the virus from the body, which would be ideal. The second one is what we did in our study, where we show that even without antiretroviral therapy, people are able to control the virus for a prolonged period of time, for at least 1 year, without having to take antiretroviral therapy. So a step, and a very important step forward.
Okay, and you've alluded to my next question, which was going to be, how are the results of this treatment really different from achieving an undetectable viral load through the use of traditional medicine? So maybe a little bit of expansion on that, Thumbi.
Absolutely. So antiretroviral medication is, first of all, I'd like to say antiretroviral medication is very important because it keeps the person healthy. And it, as I mentioned, it suppresses the viremia or viral load to undetectable. So that's very important for the health of the person living with HIV, but also for public health, because the person cannot transmit the virus to somebody else. But the problem is that sometimes there is drug resistance that can occur to this antiretroviral medication. The medication can also sometimes be toxic or have some side effects. And also it's a burden, both socioeconomically for people, because they have to buy the medication or take it for life. So what we are trying to do, and what is different about our study, it shows that through this immunotherapy, people can control the virus for a prolonged period of time to undetectable levels, just like in the case of ARV, but without having to take the ARV medication every single day. So you can imagine for somebody living with HIV, if they are able to live a healthy life without having to take a pill every single day, that's an important advance. And that's what we are showing in this study, that it is possible, at least for a small percentage of people.
And I think my understanding or what I'm taking home from what you're saying is that out of the 4 people, you noted that they were able to go for almost 1.5 years without the need to be on ARVs. But we're not saying that the virus disappeared completely from the body. It's just that in the bloodstream, there were minimal or undetectable amounts, correct?
You are absolutely correct. So this is not a complete cure of HIV in these people. In fact, we are monitoring them very carefully to see whether the virus rebounds, because we don't know whether the virus is going to rebound. And it is possible that the virus might rebound. And this is why we are saying these results, although they're important, or they're an important milestone, they don't yet represent the kind of breakthrough that would be rolled out widely. So this particular medication, this particular regimen that we used in our study will actually not be taken forward because it worked in only 20% of people. We need a much higher success rate in order for this to become a medication that can be used widely. However, it is an important study because it shows that we are moving towards that goal where we can induce antiretroviral therapy-free control of the virus, which is what people living with HIV would like to have.
I mean, Thumbi, we're wishing the 4 people, well, and hope that they don't need to come back on ARVs as ARTs as you're monitoring and tracking them. I guess the question now, and we know how science works, there's always the aspect of you discover, you develop and then you deliver to the population. Just curiously, before I come back to the issue of gender, because this was only in women, so I'll be interested to find out why weren't men part of the research cohort. But very quickly, what would be your next step? Because you're saying these numbers are significantly small. So would the next step be to test it out on thousands or millions of people, perhaps?
So yeah, you're right about the scientific process. The scientific process involves discovery, and then development, and then delivery or implementation,
which takes years.
This kind of research that we are doing is still at the discovery phase. Actually, it's very early in the phase of this research. So what we are doing, the next steps will be to do laboratory studies in these 4 individuals that were able to control the virus and compare them to the 16 that did not control the virus. So that will give us hopefully some insights to tell us this is the reason that this is working in the people that are controlling. And our goal then will be to then develop that knowledge or use that knowledge to develop the next intervention, so that the next intervention can be better than the one that we used. And that will help us move the field forward. But at the moment, because this regimen worked in only 20% of individuals, it cannot go forward. And so we will not be rolling it out. And that needs to be clear to the public.
Yeah, because I'm imagining you're probably getting a lot of requests from people saying, "Oh, can I be enrolled in the research, and can I also receive the treatment, the ART and then the immune? I think you called it combination immunotherapy." So I would not be surprised that you're getting a lot of inquiries on that. And why women and no inclusion of men?
Before we go to the men and women issue, actually, it's true that I've gotten a lot of emails from people asking, can I make this treatment available? Yeah. So I think it's important for me to clarify that this regimen is not going to go forward because we have very effective ways to control HIV, and that's antiretroviral therapy at the moment. Our intervention worked in only 20% of people, and there was a special group of people. I'm going to explain a little bit why there was a special group of people. So it's not, at this stage, something that can be rolled out widely to the community. So that needs to be clear. So for those people who are calling me with very good intentions, saying they would like to get this medication, and can I make it available for them? I'm sorry, but we will not be able to do that because we need a much higher success rate for this to become publicly available. And that's why we are now back to the laboratory to study blood samples from the people that were in our trial to understand better and see how we can develop the next intervention and make it better.
I mean, Thumbi, on the note of not going forward with this, but getting so many inquiries on the continent, we know we have a problem of enrolling people in clinical trials. So I almost see like this is a fantastic opportunity for you to be able to get, people in the masses who would love to participate and perhaps also get some form of treatment or reprieve when it comes to the HIV virus.
Oh, I think it's very important for us in Africa to be at the forefront of these studies, because what happens is that for every product that is out there in the market, it has to be tried and tested in people first. And what happens is that if we don't test it in the African population, it delays the delivery of that product into the African market. And so we get it much later. And in the meantime, people suffer a lot. And also the other thing is that sometimes medications might induce side effects in certain populations. And we need to be able to tell that as early as possible so that we don't keep developing something that will not work in our population. So it's very important that the African population is involved early in clinical trials. And this is what this study does. It sets the pace for doing this kind of work in Africa. And I hope that it can be an inspiration, not just in the HIV field, but also for other fields, for people to get involved in clinical trials early and help to move knowledge forward.
And you are evading my question on why women only?
Yeah. The reason we did this study only in women, first of all, women, there are some HIV cure trials that have been done in the past. But those HIV cure trials have been done in mostly Western populations, in Europe and in the US, and among men, because the majority of people living with HIV in those countries are men, particularly men who have sex with men, gay men. So we don't know how these products might work in women. And so we were very keen to test this in women because women bear the brunt of the epidemic in Africa. About 53% of people living with HIV are women. And so we need to get these products tested in women because sometimes men and women react differently to therapeutic drugs. And that's why we were so keen to involve women because they are disproportionately affected, but also they are a very important demographic for testing products because if these products are going to be used in women, they need to be tested in women. But the third reason why we tested this in women is that we had a cohort of women that we have been following over a long period of time in a study we call FRESH, and we have developed a very good relationship with the participants and the women in that particular cohort. And so when they heard that there might be the potential for a cure, they were very keen to be involved in the study, and they are very well informed about the kind of work we do. We have developed a long-term relationship with them, and they were very keen to be part of this groundbreaking study.
Are you able to very briefly, in perhaps a minute, tell us about the FRESH study, the what, the where, the when, the who, and the how?
The FRESH study, FRESH stands for Females Rising Through Education, Support and Health. It's a study that we began about 13 years ago in 2012. Yeah. So it's been ongoing for a long time.
Plus.
The idea behind the FRESH study was to see whether we could combine a socioeconomic empowerment program with a basic science research program. In other words, instead of just asking participants to come and donate their blood for research, we wanted to also help them in their daily lives to make their lives better in a small way. So what we did was to design a socioeconomic empowerment curriculum, meaning they come into our clinic twice a week on Tuesdays and Thursdays. And when they come into the clinic, they learn how to use computers. They learn about job skills. They learn about work etiquette, how to prepare for interviews. And so that helps them to make their own personal lives better, because most of these are women who are not working at the moment. At the same time, we collect blood samples from them for biomedical research, including HIV prevention research, as well as HIV pathogenesis type of research. So we are trying to combine both science, but also socioeconomic empowerment. Brilliant. So that's what the FRESH cohort is. And it's been very successful because about 80% of women in that cohort end up getting jobs. So it's been very successful in that way, and it has helped to advance both HIV prevention, but also HIV cure research and move it forward.
No, I mean, that's brilliant, Thumbi, for a decade-long research or study that you've been ongoing. And then it sounds like it's from the FRESH study that you're able to conduct the HIV cure trial, which has had these positive findings. I want to take you a little bit back into the reaction of, say, people who've been living with HIV for a longer period. Does the findings that you're getting right now with the HIV cure, what does it mean for people who've been living with HIV quite for a longer period, especially those with weakened immune systems?
I think this study offers hope. First of all, that there might be hope in the horizon, so that they might be able to one day come off antiretroviral therapy and still continue to live healthy lives. So I think it offers that hope. Just to remind people, when antiretroviral medication was developed in the late 1980s, early 1990s, having HIV used to be a death sentence. And the first early drugs that were developed were not very good. They were very toxic, and people would take them but not feel very good. But we have progressively improved. And now we have very good medication that allows people to live very healthy lives. And people don't have to die of HIV anymore. So in the same way, we are making small steps now towards an HIV cure. So at this moment, it seems almost impossible to achieve an HIV cure. It seems like a dream. When I talk about HIV cure, people say, what? And a lot of people can't believe it. But I think we need to make these small steps until we reach a stage where we're actually able to cure HIV, so that HIV can be completely eradicated from the body. So it's not going to be easy, and it might be a long road, but we need to be on that road, and we need to be part of the steps towards that innovation and that progress.
Thumbi, what would you say to people who say that this cannot possibly be done, or the discovery could not have been achieved on the continent, in Africa? Do you think if you were, because your bio tells us you did a lot of work and research in Harvard, do you think you'd have made similar discoveries whilst in Harvard, or was there something unique about being based in South Africa and on that continent that enabled you to make this discovery?
Well, I've always been a believer throughout my life that innovation can come from anywhere and from everywhere. But innovation and progress also does not come out of the blue. Innovation and progress comes out of investment. And one of the challenges that we have in Africa is that we have not invested enough in the potential, in the infrastructure that is needed to move us forward. And so we have had to continually depend on other people or products that are made elsewhere. This is not sustainable for us, as we have seen, for example, with cuts in funding by the US government. So what should we do is really believe in ourselves, invest in our people, invest in our infrastructure, support our young people, support science, and engage in equitable partnerships with people, because, as I'm going to tell you in a moment, in our own research, it has taken partnership. And if we do that, if we invest, if we believe in ourselves, we can make the innovations and the progress that we need in order to overcome the challenges that we have in Africa and elsewhere.
And to me, it's as if you're reading from my script, because my next question was going to be, in this era of global health financing being at a crisis, what would be your guide or top 3 recommendations to African governments and leaders who have had to pivot to locally fund healthcare, especially for people living with HIV? Or put it a different way, if you are a leader, an African president, head of state, what is it that you would want to hear from our top African science leaders to help guide on how to prioritize and fund support on healthcare and health research?
If I was a leader, particularly a political leader, I would like to see nothing but action. We need action. We have had very good documents over the years that talk about how to craft development for Africa and how to sustain development in Africa. We have talked about a science-driven economies in Africa. Vision 20, I think it's 20. We had Vision 2030, Vision 2060, 2050 for Africa, and all these documents talk about a science-driven economies. But science-driven economies will require investment. So we need to move away just from talking to doing. And that means putting money where if you think about the money that is wasted, that is misused, that money can go a long way to help our young people to go into science, engineering, mathematics, and other fields of society, and make a good life for themselves and for the continent. So we need investment. We need to invest in young people. We need to invest in strong institutions for a better future for all of us. And it's time for our leaders to stop talking and start doing by investing and putting money in the right places and making sure that money is not being misused, so that we can have a better Africa. Yeah,
I mean, usually we always ask the scientists to put some recommendations forward to the leaders themselves. I think now I was putting it to you or throwing it back to you. If the shoe was on the other foot, if you're the head of state, if you're Cyril Ramaphosa, for example, and you had these African science leaders with a breakthrough, what is it you would want to receive guidance on, and how should that also be communicated to you?
Yeah, I want this kind of science broken down science is not easy to sometimes understand, and the scientific process can be difficult sometimes for people to understand who are outside of the science. So I would want this science broken down, and I would want to know what it actually means for people, and particularly what it means for the future, and what can be done to move this kind of work forward. What kind of investments, particularly for young people and in science infrastructure, is needed to make sure that this work is sustained without having to depend on outside donors. Because I can tell you, most of the funding for science in Africa is being funded currently from outside the continent. Why should that be the case? Well, you have talent on the continent, where you have young people with a lot of potential. It's not sustainable to depend and rely on others. What we need is to look more inward in terms of supporting the things that we want to prioritize and the things that we believe in.
On the issue
for our own good.
On the issue of talent and infrastructure, I mean, we have seen and you have shown us that this can be done. It can be done on the continent, even with low resource setting and poor infrastructure. We're not saying that these are the best situations or environments to work in. A lot of improvement has to go into that. You have talked about the visions that we have in Kenya. This is Vision 2030. For the AU, or the African Union Development Agency, AUDA-NEPA, this is 2034 STISA, and also for the African Union, which is the 2063 Africa we want. Thumbi, you did not do this alone. And would like to give you an opportunity to spotlight some of the brilliant people on your team. So who are these individuals who you've been working with on this discovery?
Well, first of all, Juliet, I've been incredibly lucky in my life to have very good mentors, people that have believed in me right from my young days at the University of Nairobi. I remember Professor Susan Bogua, Professor George Kinoti, and many others that nurtured me when I was there. And now for this particular study that we just did, it's all about partnership. So I would like to acknowledge my colleagues at the HIV Pathogenesis Program of the University of KwaZulu-Natal, my colleagues at the Africa Health Research Institute in Durban, my colleagues at the Regon Institute, people like Krista Dong and Bruce Walker, who I worked with on this study. And then our colleagues in the pharmaceutical industry, particularly Gilead, who were partners in the study. They supported this study, but they were also provided some of the products that we used for this study. They were absolutely, we couldn't have done this without them. And then finally, I would like to acknowledge also the community and the study participants. We couldn't have done this without cooperation and without partnership with the community and the study participants. We have known each other for a long time now. We have developed a bond of trust, and we do everything in consultation with them. And so it really does take a village, and my village has been very large and big and very talented. And so I'm very grateful for that.
Well done. Thumbi, your parting shot as we wind up?
No, I think my parting shot would be that this is it's a landmark study because it shows that what is possible. But this is not the end, and it cannot be the end, because this medication is not something that is going to go forward in its current form, as I mentioned. So what we need to do is to use this moment as an inspiration to aspire to do big things, to innovate on the African continent, to invest in our future, to invest in our young people, and to know that the future is bright if we work together, and if we believe in ourselves, and if we believe in the important work ahead. So that's what we need to do. use this moment as an inspiration.
No, Thumbi, and what an inspiration you are. I mean, you've inspired us so much that we've had you back onto the podcast a second time. This is the first time we're doing that.
Thank you.
Like I said, you know, in an era where we are faced with multiple crises around the world and not only on the continent, this is a bit of good news when we do need some of positive news. Even though you've said that, you know, the findings of the HIV cure trial, this is the end, or this is where it stops, but it leads you to go on and continue on the journey of discovering what a possible cure could look like. And it's hopeful to know that this can be discovered on the continent. It just doesn't have to happen outside this continent, especially with brilliant brains like yours and your colleagues as well. Thumbi, like I said on our previous podcast, we are looking forward to you receiving a Nobel Prize. Please don't forget us and call us. We should be one of those first people to call when you do receive this, because of the amazing work that you are conducting, and not only on behalf of South Africa, but actually of Kenya, your home, and the entire continent, and as well as the globe. Thank you so much for your time, Thumbi.
Thank you very much, Juliet, and thank you again for having me on the show. It's always a pleasure, and I really enjoyed it. Thank you.
Thank you.